Come on, you need a big mind change to appreciate it, to understand that. So my topic is fixed appliances, which needs an open mind. And when it comes to entrance, it's no different. Until and unless you know some basics, it's very difficult to answer the NEET or the National Board or Australian Dental, whatever question you come across. It's not that easy. So that's why I wanted to start off with that. And then my philosophy of 15 minutes of discussion, you should be able to get 15 minutes of explanation by a faculty. You should be able to answer 5 MCQ questions. If that's the way you approach entrance exams, guys, it's not that tough. It's not that tough at all. And the team focus is ready for that. And team focus is equipped with that. You just look at the caliber of the faculties of team focus, you will understand what all they have achieved. There are people who achieved Kerala entrance, and myself have done National Board Part 1, Part 2. So there are people who have done all this, guys. Just be there and be ready to learn. We can make a big difference. By the way, I would like to request people to come in videos, please. I hate talking to my computer. Already told that multiple times. Dr. George, I think when our main classes come, I will make it mandatory that the video has to be switched on. Okay, now it's not mandatory. These are like free webinars. Now it's not mandatory, but in the main classes, Dr. George, what do you say about that?
Yes,
I mean, my daughter in 10th standard, 11th standard, it's mandatory that the video has to be switched on. Yeah, why can't a focus entrance coaching with the video be switched on? It should be switched on mandatory. Not today. I'm talking about the main classes. What do you say, Dr. George?
Yes,
let's plan that.
Let's plan on the videos. Yeah? We have much more energy to teach, because we can, rather than speaking to a non-living computer, we can at least see the faces and see the smile on the faces.
Exactly. And see the yawning on the faces. See everything possible on the faces. Yeah, let's.
We can see a lot of positive faces here. That's what
that's what even I like to see. And so, okay, good. Many people have come out with videos. Thank you so much. So that's it. Let me just go quickly into my topic, fixed orthodontics. Now, fixed orthodontics needs a little bit of history. History is boring, as you all know, but you have to know certain names like Pierre Foucault. Pierre Foucault is considered as the inventor of orthodontics. Guys, an entrance question, I have seen this question, who is the inventor of orthodontics? Not father. I'm sure you've heard all this father, grandfather stuff. This is inventor of orthodontics, okay? That's a very tricky question I've seen. Keep in mind, Pierre Foucault is considered as an inventor of orthodontics, not exactly father of orthodontics. There are some textbooks saying he is considered as a father of orthodontics too. So please keep that thing in the mind very clear. Pierre Foucault can be called as inventor as well as father of orthodontics. But we have an entirely different category coming up soon. I will talk about it. This guy way back in that year with those wires and all that moved teeth. And then Dr. Begg, Australian orthodontist, Dr. Begg with his Begg technique. Pin and tube technique. Remember these words. Pin and tube technique. Begg technique. Ribbon arch technique. Multiple names that can be given to this particular technology. Dr. Begg. Why am I specifying Begg is because questions are coming in MCQs related to this. With that single slot bracket and a brass pin, the wire is put in and he moves teeth. But what are the problems with Begg technique? The biggest problem with Begg technique is it's a huge slot, okay? Guys, it's a huge slot with a thin wire inside, too much of play that when you move the teeth kind of tips like that. That's called uncontrolled tipping movement of the teeth because of too much of play there. That's the biggest problem with Begg technique. You get to see all these kind of results with Begg technique. And then Dr. Begg improvised on that by adding on to uprighting springs and all that, but many were lazy to go into that stage. So the Begg technique lost its popularity because of that. Then Dr. Angle, Edward Angle, in America, in Australia, all these things were going on parallelly in America. Angle came with something called as E-arch. E-arch was the first thing that Angle came out with. And then he improvised on E-arch and he got this Edgewise appliance. Guys, listen carefully. Just because he got Edgewise appliance, he's considered as the father of modern orthodontics. So Pierre Foucault can be father of orthodontics or inventor of orthodontics, but Angle becomes the father of modern orthodontics. Very, very common question in any platform. Who is the father of modern orthodontics? Dr. Angle. What are the problems with Edgewise? See, what Dr. Angle did is that Begg round wire he made into rectangular wire. The Begg round slot, he made that the round slot of the Begg, he made into horizontal rectangular slot. So now you have a rectangular slot, rectangular wire going in like that. That's what Angle did. He completely changed the configuration. Round wire to rectangular wire. Now, what is the problem with Edgewise? Every technique has its own problems. What's the problem with Edgewise? Problem with Edgewise was you put a rectangular bracket, rectangular wire, move all the teeth moves flat. All the teeth moves flat. It's called flat smile. Flat smile was the biggest controversy at that time with Edgewise appliance. What do you mean by flat smile? All teeth in the same level. Because the same bracket for all the teeth and all the teeth moves to the same level. Guys, just go back to your prosto first year BDS. First year BDS prosto teeth setting. Don't you remember that time? How many years you have to go back? I have to go back almost 30 years. How much of a year you go back, let me tell you, you will not forget those times of prosto teeth setting, walking around with an occlusal rim and the teeth set and taking some wax out and putting a teeth there and trying to get the signature. And when you get the signature and then you put the next teeth, the sir says, remove both. Sir, the other one you already gave me a sign last day, remove both. In Manipal, we used to have people who throw it out of the window and we used to collect it lunch break from ground floor. Guys, I am talking about what are they trying to do here in prosto. Every teeth, every ideal smile has something called as a smile designing. That is, number one, every teeth has a horizontal relationship. Some teeth out, some teeth in. In simple terms, central incisor, when you compare to lateral incisor, central incisors are slightly out. Laterals are slightly in. Canines are out. Don't you remember that? So, that is the biggest issue with Edgewise. All teeth will be flat. There's no in and out. That's called in and out in orthodontics. And for in and out, what Dr. Angle did is he started doing wire bending. This first order wire bending. First order wire bending. Look carefully here. Look at that small bend given to the lateral. So the lateral will be slightly in compared to the central. That's called first order bend. Then second order bending is that angulation. Every teeth is not the same. Both centrals are not like flat like this. It's slightly angulated. Slightly angulated. That's a second order. That's a vertical. The first one I talked about are the horizontal. Now you compare all this with your prosto. Compare with the prosto. Look at the teeth setting from the occlusal view. You can see the horizontal in and out. Look at the thing from the front view. you can see that slight tilting of each teeth. That is a second order bend that has to be given to each teeth to get those bends. And then the third order bend, that's called torquing. Very tough, guys. This is not very easy here. This is hi-fi stuff in orthodontics, torquing. Torquing is every teeth has an angulation. Central angulation is different from lateral angulation. Canine is more upright. Central is more like this. Lateral is little like this. And the canine is upright. Don't you remember in prosto, the professors used to tell you, push the neck in, push the neck in. Do you have any idea what that fellow was talking about when they said push the neck in? He was talking about correcting the torque of individual teeth. That is done in Edgewise technique by using wire bending. Individual bracket area in the wire, you have to twist the rectangular wire and look at the close-up of this. Look at this. The wire is not going in straight into the slot. Wire is going in slanting into the slot to give the corresponding torque to that particular teeth. That's the torquing. Then came straight wire appliance by Dr. Andrews. By around 1970s, Dr. Andrews came out with straight wire appliance. That was an innovation in dentistry. Dr. Andrews was a poor wire bender. He never wanted to do this first order, second order, third order wire bending. He wanted something different. You know what he did? He modified the bracket. He modified the bracket in such a way that you don't have to bend the wire. The bracket has changes. Let's look at this. This bracket, if you look carefully, has a small inclination of the slot. Look at this bracket, severe inclination of the slot. So all you have to do is to put a straight wire in. The teeth will get its required movements. That's called straight wire technique. No wire bending required. Straight wire technique by Dr. Andrews. Amazing concept. No wonder he's called as the father of modern orthodontics. He revolutionized orthodontics, including torque. Look at that. Instead of that straight going in, the bracket slot is designed in such a way that you just have to put a straight wire in like that. The teeth will get the required torquing. That is what Andrews did. Now, the biggest issue here was every bracket is different. Upper central incisor right bracket is different from upper central incisor left because the inclination is opposite. You can interchange the brackets. In Edgewise or Begg, you can put any bracket onto any teeth and move teeth, and the finish was with wire bending. In straight wire, the finish is with bracket positioning. Earlier, best wire benders were considered good orthodontists. Not anymore. Remember in your undergraduate time, first year BDS, second year BDS, you used to tell your friends, oh, you will become an orthodontist. How nicely you're making a square, rectangle and all that. Wire bending is not the criteria now. Now, whoever is the best bracket positioner, they are the best orthodontist, not the best wire bender anymore. Quickly, let's go see some questions related to this. Guys, this is just 15 to 20 minutes and questions, okay? A lot of stuff to learn here, which we'll be explaining step by step in our micro sessions coming up. Do not worry. I know I'm going a little quick, but these kind of topics, guys, are so simple. You guys worry about big stuff. You have pathology. You have all sorts of stuff going on. Ortho, guys, it's nothing. Just listen to all this. And the best part about the team focus is all of the departments are so gelled together for the last 5 years. That is the beauty I found in focus. I just joined focus a couple of months before. But I found out that last 5 years, that bonding they have with all the faculties, That interaction they have every week, 2 staff meetings. Guys, these guys are doing something like Byju's app, I would say. That kind of dedication going on in this area of how to improvise entrance education. Hats off. Now, Edgewise bonded brackets. Okay, let's see like this question. Edgewise bonded brackets are used. Answer A is on incisal edge of anterior teeth. Incisal edge of anterior teeth. Option number 2. See, no brackets are put on the incisal edge anyway. So this option doesn't look sensible at all. To obtain edge-to-edge occlusion, no, edge-to-edge occlusion is never an aim in orthodontics. So that answer also doesn't make any sense. With rectangular arch wire, remember I told you Edgewise uses rectangular arch wire. Answer C seems to be correct to me. But let's look at answer D. With labial arch wire at incisal and gingival edge of each bracket, no, doesn't make any sense. So the answer obviously is C with a rectangular arch wire. Next question here is the first orthodontic appliance devised by Angle. First orthodontic appliance devised by Angle. Can somebody come to the chat box and tell me the answer to this? Not A, B, C, D. Come on. I haven't put the choices. But the first orthodontic appliance by Angle. I just told that actually in the E-arch. Oh, perfect. You guys know everything. Yeah, I'm going to go fast. You guys know everything. Yeah, perfect. So Edgewise, no. Edgewise was not first Angle's device. Pin and tube, no, it is with the Begg, and the E-arch is the correct answer. Ribbon arch is also a modification of the pin and tube only. So the answer is E-arch. Perfect. In Edgewise appliance, answer A. This is from the national boards. First order bend is given in horizontal direction. First order bend is given in horizontal direction. That's true. I told you about the in and outs. So that's first order, that's horizontal, that's true. Second order bend is given in vertical. Yes, it's in vertical direction. Second order bend is in vertical direction. Third order bends are placed by twisting the wire. The wire had to be twisted so that it goes into the bracket and gives the torque. All 3 answers seems to be correct. So the last one, all the above are correct, is the answer for that. Father of modern orthodontics, I covered that. Angle, Tweed, Purificard. Yeah, to confuse you, Purificard can be there. And Begg, yeah. So the answer obviously is Edward Angle. Straight wire appliance was developed by. Straight wire appliance was developed by. You want somebody to answer that? Gayatri said Andrews, but Revati said Begg. No. Revati, no. Yeah, Andrews makes sense. Yeah, A, Angle, B, Andrews. Andrews makes sense. And then Begg and the Panchers, they have their own thing. So that's Andrews is the correct answer. Straight wire appliance was developed by